My name is Yolanda, and I am one of the clinical care leads with 2G. COVID changed healthcare. It changed it completely. And where we went from bedside nursing, nursing in a doctor's office, to remote. I honestly, as a nurse, did not think that I would be able to be as effective doing it remotely, but let me tell you that I love it. It has expanded my profession, at least what I knew as a nurse. It has challenged me. How do you fix the same problem in a different way? I absolutely love the relationships that I have formed with my patients. One of my patients, unfortunately, had been with pain management for 9 years. And through an accident, she had a chronic condition that affected her spinal canal. So she was in a lot of pain. So much so that she was unable to attend her mother's funeral in California because she just could not drive, she could not fly. In getting to know her and getting to understand what happens to the psyche when someone has chronic pain and how that limits their life, how it limits their mental health, how that limits their emotional health. So her and I became close through that. Okay, this is 9 years of the same treatment and she's not getting better. And it's not just about treating the symptoms, it's resolving the problem. And so through months and months of negotiating with the insurance company, with finding somebody that was willing to see her, a neurosurgeon no less, a neurosurgeon. She just had her surgery in August of last year. And I'll have you know that she traveled to California to see her family for the first time in 9 years because the neurosurgeon got to the bottom of the problem and was able to help her enough to where she has a life now. And so when we speak, and we speak quite often, when we speak, she is doing so much better with pain control. And it's not pain control, it's resolution of her pain. She's 69. She has so many years ahead of her that now she can actually live her life. I think establishing relationships with patients is important. They need to know that you care, because if you care, then they will be more apt to open up. They'll be more apt to follow your advice. They'll be more apt to do as the doctor has, ordered them to do. I think that's important. And I don't really see how you can have a successful chronic care management program without those relationships. Take care of the patient. Irregardless if you have to spend more than the allotted time, you take care of that patient because we're care managers.